Dr. Ennis here at Ennis Plastic Surgery in Boca Raton, Florida. Today we're going to talk about the blue peel, or specifically a TCA peel, and how it affects the skin and how it helps us in that aging process. So today let's talk about the chemical peels. What's the difference in a chemical peel and a laser? What is a TCA peel? What is a blue peel? So first of all, what we're trying to do is to tighten up the skin, to fix the fine lines, sun damage, brown spots. So we sort of divide it into two parts. So the surgical things fix structural problems, but they won't fix the fine lines, sun damage, brown spots. So how do we fix those? Well, we have to transition back to the other side of the spectrum and look at lasers or chemical peels. So when we're doing surgery, I typically like the chemical peel better, but partly because it's dry, it's easier on the skin, it's a little more forgiving when you're doing it at the time of surgery. So one of the lasers, what are the chemical peels doing? Well, what they're doing is they're tightening up the skin. So whether you're using laser energy or chemical energy, in a very controlled manner, you're tightening the skin or you're injuring the skin. All scar tissue, all injuries heal by shrinking. So in a very controlled manner, we're trying to injure the skin in a way that the skin then tightens up, building collagen, tightening up the fine lines, sun damage, and brown spots. So what's the recovery from a laser or a chemical peel? Well, the lasers are frequently wet and weep. Chemical peels are typically dry. And so we find chemical peels a little easier to take care of because they're more like a sunburn. In this scenario, you'll see that this is the day of a chemical peel, obviously called the blue peel because it has a blue dye in it. So this is day 2, 4, 6, and in about 8 days or so, it's all healed up. So this particular patient had a chemical peel and an upper blepharoplasty done at the same time. And by a week, you can see she's very presentable. The bruising's gone and the chemical peels all come off. So her skin's a little pink. It's going to be a little sun sensitive, but just a hat, some sunscreen for a few weeks. But it does a remarkable job of fixing what we can't fix surgically, which is the fine lines, sun damage, and brown spots. So these can be combined with a surgery or done independently here in the clinic, but they do a great job of fixing those nuisance problems like the fine lines, sun damage, and brown spots.